So I was talking about some of the work that we're doing in the Icahn School of Medicine, where we have a large biobank of 40,000 patients in our health system. And what we do in my lab is we look at the link between our genes and our ancestry, and then how that impacts our health outcomes. So what I was talking about today was building a large genetic map of 32,000 New Yorkers that includes both their genetic ancestry and links to neighborhoods they live in, which involves, of course, the environment that they live in, and then looks at their full medical record to understand the complexities of then how that plays out for their health. And what we find out is, it turns out it's very important. And when you work in a city like New York, it's of course a laboratory to understand the health of all of the rest of the world. We really can encounter people from 100 countries around the world in New York City. So what we're able to find is unknown or little known either genetics, genes that underlie disease, or previously underappreciated incidence of certain diseases in some populations. So for example, we find a high incidence of peripheral artery disease in people from Dominican Republic. We find a genetic disorder for fairly serious heart disease called hypertrophic cardiomyopathy in a population from Central America. These things are of course very important to know about because they're risk for these populations. So a lot of the work that I do in my lab is really thinking about how we can improve the health in these populations by leveraging the genetics. Yeah, so one of the things, for example, that we can do is look at different population groups in New York and where they're living. So one example is Puerto Ricans. So using genetic ancestry, we can identify who might be born in Puerto Rico or have recent Puerto Rican ancestry and who are living in different neighborhoods of New York. And then we can look at things like asthma. Asthma is a very serious pulmonary disorder that usually affects children. It can be quite chronic, it can be quite difficult to manage. And it turns out that if you're Puerto Rican and living in certain neighborhoods in New York, you have both a genetic and environmental predisposition for a vastly increased rate of asthma. So using that information, we can connect with the communities, we can connect with public health officials and try and understand better how we can intercept and mitigate the impact of asthma in Puerto Rican populations. We can do targeted screening with other interventions either at frontline clinical care or in a public health capacity in the community. Ideally, the best solutions are usually a combination of all the tools that you have in the toolbox to reach the communities. So genetics actually helps add to that picture enormously in concert with the types of approaches that we use already. We all have our own shake of the dice when it comes to genetics. Different populations, much like different families, will have different diseases. What's important to understand is which populations are at risk for which diseases, both from an individual perspective, so that if I know that my population has a specific disease, I can look out for it in my lifetime, but also from the healthcare perspective, so we can devote the right resources and the right interventions at the right stage of people's lives to help them with their disease risk.